So what does Pulsewave do? Pulsewave is our trademark name for low-intensity shockwave therapy for erectile dysfunction. And what it is basically a version of sound wave therapy that's utilized to help with erectile dysfunction. High-intensity shockwave therapy has been used for decades for treatment of kidney stones, and a lot of people may know about shockwave therapy for kidney stones, but basically you've got a device under anesthesia that sends shockwave into the kidney to break up kidney stones. What happened is there's a modification of that called low-intensity shockwave therapy that has been used in Europe for years to help break up plaque, break up scar, and increase angiogenesis or blood flow into knees, hips, joints, plantar fasciitis, things like that. That was then FDA approved in the United States, so a lot of our colleagues in the orthopedic world use shockwave therapy, low-intensity shockwave therapy to help regenerate and help heal in a lot of joint issues. Now in Europe, they decided to go ahead and do several trials, clinical studies, to use low-intensity shockwave treatment to help with erectile dysfunction. And it turns out for mild to moderate erectile dysfunction, it's been significantly helpful for those people. In fact, now it's first-line therapy for treating people with erectile dysfunction in Europe. The Pulsewave therapy is a total of 8 sessions. Each session takes about 30 minutes or so, and it's done typically on a Monday and Friday for 4 weeks. For some people, if their schedules don't permit, it can be once a week for 8 weeks, but it's a total of 8 treatments, 30 minutes for each session. So what we're noticing, again, there's a total of 8 treatments that are required. People are starting to notice beneficial effects in terms of increased sensitivity with erections. They're noticing better morning erections. They're noticing better erections when having intercourse, and they'll typically start noticing these improvements in session 4 and 5 out of the 8 treatments. So midway through treatment, you're already noticing the improvement. I think for a lot of people, just taking a pill works for them. Pills can get expensive, pills can have side effects. For people with more significant erectile dysfunction, there's injections for erections. But the beautiful, brilliant thing about Pulsewave therapy is based on all of the studies, as well as all of our clinical patients that we've taken care of, there has been no negative side effects. This is really a non-medical therapy, which is to say there are no medicines that are required, as well as it's a non-surgical therapy, so no surgery is required. So this is really stimulating your body to break down plaque within the penis, which is really one of the hallmarks of erectile dysfunction is we're not getting enough blood flow to the penis. So this is helping to break down plaque. It's also stimulating growth factors to the area, which will also help with regeneration, as well as inducing angiogenesis. So we're increasing blood flow to the penis. And at the end of the day, this is a blood flow issue. This is a nerve-related issue, and pulse wave and shock wave therapy to the penis really has been shown to improve all of these.